sun is shining 24/7. 'Cause when we're together, it feels like we're in heaven.
Hey, this is Dr. Lacher. Shout out to all our patrons out there. Thank you guys. This week we're going to talk about eyes. We're starting here with nice normal right eye, wide open, no tearing, no squinting, nothing like that going on. Super normal right eye on Paul. Followed by a left eye that is ever so slightly squinty. You'll see we don't see a lot of tearing. We don't see, major squinting going on. We just subtly have those left eyelashes pointing down towards the ground versus his right ones that are parallel to the ground. Paul had some inflammation going on in that left eye, and this was really the only indication we had that something was going on. So if you guys see that, that is very important, and you should call your veterinarian that you have a great relationship with. They are probably going to come out, and first thing we'll do is check with the ophthalmoscope, which is a magnifying glass basically that we use to look at the eye. Front, middle, back, we're checking for scrapes, contusions, things on the lens, inflammation in the back of the eye. There's all kinds of stuff we can see with this, including something like this. What you'll see is that faint whiteness there, and then there's that bright white squiggly line that we're going to put a circle around. That is most likely an ulcer, and the way we're going to know that for sure is we're going to put some fluorescein. That is this bright green stain here, and what it does is it sticks to corneal epithelium that is not intact. So, for instance, here you'll see that there's puddling and pooling of the green around the edge, but there's none of it sticking to the cornea itself. Versus if we have something going on in the cornea, it's actually going to stick and show us a faint green sheen like we've got here. This is a pretty typical ulcer for us, and this is a horse that we would just put on some triple antibiotic or BMP, not Neosporin, and maybe some atropine to dilate the eye, and probably some anti-inflammatories, and all should be well in a couple of days. We'll recheck it, make sure everything's good. If we see something like this, or this with melty bits in the center, or this with the white spot, which is a stromal abscess, then we're probably going to call in this guy. And he is an ophthalmologist in our area, Dr. Mangan, and he's looking at this eye with a slit lamp. What a slit lamp does is gives you really good magnification of the cornea and lets us get a really good evaluation of what's going on in there. We can look at all kinds of stuff actually in the front of the eye with slit lamps. They're pretty cool things. The other thing he's going to do is check pressures. This is a tonopen. You put a little anesthesia in the eye so they can't feel this thing touching their cornea. And then they're going to get a number that tells you what the pressure is in there. And that's like when you put your finger on your eyeball and you push it and you feel that pressure back. That's what number we're getting there. Sometimes with these guys, the only indication you have that something is going wrong is that pressure in one eye is less than the other. And that'll be all you get. Next, he has stained the eye as well, but he's looking at it with a blue light that pulls that fluorescein out. We have the same thing on our ophthalmoscope, but it pulls little tiny bits of fluorescein out that you can see with the with the slit lamp here. So you can see tiny problems. If we've got any of those big problems that we pulled in an ophthalmologist for, we'll probably put in an SPL, and that's what this is. It's a tube that comes down and goes into the upper eyelid and allows us to deliver medications directly to the eye while standing close to the wither, so we're not squirting things directly in the eye. We put what's called an eye saver hood over the top, and that is this black hood with a solid black cup that protects the eye. First off, they can't itch it as well, and it also blocks a bunch of the light. You know, when your eye hurts, you don't really want to have a lot of light going into it, so the eye saver hood does a lot of those functions for us. The other thing it does, it's got some cool stuff on the inside. It's got this ring right here that absorbs a lot of the tears. These horses make a lot of tears. And then we've got the gauze that puts pressure on the eye, like you putting your finger against your eye when it hurts. So that's what the hood does. Next, we've got, like I said, so we got the tube coming down into the upper eyelid, right there. It goes through a hole. Then the tubing goes down the mane, and we're able to put the medication in back here at the withers. We put a lot of medication in these horses. So every 2 to 4 hours, we'll be putting 3 to 4 medications in, and those are antifungals, antivirals, antibacterial, just a wide variety of medications to help us get aggressive with these treatments. We put a small amount of medication in, and then we follow that. Right here, you'll see with 3 cc's of air. And what that does is it pushes those medications all the way down to the eye. A lot of times the horses don't really love this process, so we're spending this whole time giving them treats to help give us some behavioral modification for it. But that is sort of the down and dirty on how we treat eyes. They are always scary for us, and they are always an emergency. So call your veterinarian. So I hope you guys enjoyed that video. It's a bit about how we look at eyes and approach eyes from a simple standpoint as a plain old regular veterinarian, and how we use ophthalmologists to help us treat the complicated eyes. A little bit about treatment on simple and complicated eyes. And I just want to say thank you again for being patrons. We really appreciate you.
So good, so good. Every single day we spend apart. I wanna be with you. Baby, take my hand, hold it tight just like you do. Feels so good.